Okay, today we're going to talk about an ancient killer, one that has figured out how to get past our body's best defenses and into our most protected space, the brain. This is the story of tuberculous meningitis. So you can understand just how serious this is, let's start with a really sobering fact. Even with the best medicine we have today, tuberculous meningitis, we'll call it TBM, it kills between 20 and 67% of the people it infects. I mean, just think about that. If you don't get treatment, it's 100% fatal. The stakes just don't get any higher.
So what exactly is TBM? Well, it's an infection of the meninges. Those are the really delicate membranes that wrap around our brain and spinal cord like a protective blanket. And the bug causing all the trouble? It's the infamous Mycobacterium tuberculosis, the exact same one that causes TB in the lungs.
But, what makes TBM so incredibly dangerous isn't just that it's in the brain. It's how it gets there. It's a true killer in disguise.
See, this is how it usually starts. It doesn't just show up one day like some other forms of meningitis. Its approach is slow, it's insidious. For weeks, someone might just have a low-grade fever, a headache that just won't quit, or maybe some subtle personality changes. And it's so easy to just brush that stuff off, right? But that gives the bacteria a critical head start.
So you have to wonder, how does a bacteria that usually lives in the lungs end up attacking the brain? Let's actually trace its path.
The invasion is basically a four-step plan. First, you breathe the bacteria in. Pretty simple. Second, it manages to escape the lungs and gets into the bloodstream. Third, it seeds the lining of the brain, forming these tiny pockets called rich foci. You can think of them like hidden sleeper cells, just waiting for the right moment. And then the final step, rupture. Those little pockets break open, spilling bacteria all around the brain and triggering this huge inflammatory response. The invasion is complete.
And once those bacteria are in, the attack begins for real, and it targets a very specific and very vulnerable part of the brain. And this brings up a really important question. I mean, with the whole brain right there, why does this infection almost always focus its attack right at the base?
Well, the answer is surprisingly simple. It's all about physics. The gunk, the inflammatory exudates that the infection creates, is really dense. So as our cerebral spinal fluid flows around, gravity just pulls all that heavy material down, and it settles in the lowest pools at the bottom of the brain, in these areas called the basal cisterns. It's a weakness created by our own anatomy.
Now, all that inflammatory stuff collecting at the bottom of the brain leads to three pretty devastating consequences. First, cranial nerves palsies. The nerves that control our eyes and face literally get choked by all that gunk. Second, hydrocephalus. The inflammation blocks the flow of fluid, causing this dangerous pressure to build up inside the skull. And third, vasculitis. Blood vessels in the area get inflamed, and that can lead to strokes. Any single one of these is a massive medical emergency.
So you've got this sneaky disease with these terrible consequences. And for doctors, it becomes this desperate race against the clock to get a diagnosis.
Trying to confirm TBM is a huge diagnostic dilemma. The early symptoms are so vague, and the quick tests we have for spinal fluid, they're just not that reliable. They only actually find the bacteria about 30% of the time. The so-called gold standard test, which is growing a culture, takes weeks, and that's time a patient just doesn't have.
So doctors have to become detectives. They look for a classic pattern of clues in the spinal fluid. And there are three things they expect to see. First, really high protein, which is basically the debris from all the infection and inflammation. Second, really low glucose, or sugar, because the bacteria are literally eating it to survive. And third, a very specific type of immune cell called lymphocytes that are rushing in to try and fight the infection.
This all leads to a really simple but powerful mantra for doctors. High protein, low sugar, plus lymphocytes. If you see that pattern in the spinal fluid of someone with a headache that won't go away, TBM shoots right to the top of your list of suspects.
Once TBM is suspected, there is absolutely no time to wait for a final confirmation. The counterattack has to start immediately.
The treatment plan is actually pretty clever. It's a two-pronged attack. On one side, you have anti-TB antibiotics to kill the bacteria directly. That's going after the root cause. But just as important, you use corticosteroids. Now, they don't fight the bacteria at all. What they do is fight our body's own crazy, over-the-top inflammatory response. They calm down the swelling that causes the worst of the damage. So it's about attacking the invader while also controlling the collateral damage.
But fighting this disease is a marathon, not a sprint. The treatment is a long, hard road, usually 9 to 12 months of daily medication. And even then, many patients have to deal with severe complications, like needing a permanent shunt surgically put into their brain just to drain all that extra fluid from the hydrocephalus.
So if there's one single thing to take away from all of this, it's this sentence right here. Tuberculous meningitis is an infection at the base of the brain that causes fluid buildup, nerve damage, and leaves a signature in the spinal fluid of low sugar and specific immune cells. That's pretty much the whole story right there.
And that brings us to our final, and maybe most critical thought. We understand this disease. We have drugs that can cure it. We know how to prevent it from spreading. So the question we should all be asking ourselves is this: why is tuberculosis, in all its forms, still the leading cause of death from a single infectious agent in the entire world?